Good afternoon, everyone, and welcome to our introduction to the behavioral health community of practice with the sponsored by UK Healthcare. And we're so delighted to have you with us today. My name is Trudy Matthews. I'm Senior Director of Quality and Value Strategy, as well as Executive Director of the Kentucky Regional Extension Center. I'm also Program Director of the Healthy Kentucky Initiative. So I get to bring my three roles together in one great opportunity. And I'm so delighted that you're joining us today, delighted to have a really great group of behavioral health experts joining us today and to kick off our behavioral health community of practice. As you all know, there has been a tremendous increase in behavioral health needs nationwide, but especially in Kentucky. And we were already not in great shape as a state in terms of our overall mental health. And so the pandemic has only exacerbated what was a challenging situation already. And so we wanted to convene this behavioral health community of practice to really together ask, how do we respond to this epidemic after the pandemic? None of us can tackle this alone. UK Healthcare, as a large academic health system here in Kentucky, can't do it by ourselves. Our community mental health centers can't do it by themselves. And I know that our primary care practice partners and friends also feel overwhelmed. And so, but we hope that together that we can continue to work together towards solutions, help each other to tackle this very difficult situation. Today, we're going to start off our community of practice providing just a little bit of background on the current concern, as it were, level setting with the group. But we also want to make sure that every one of our webinars in this behavioral health community of practice also has an important tool or takeaway that you all can use as you go into your professional setting. So I'm delighted that we're going to introduce something that is really near and dear to all of us here at UK, mental health first aid. We are really excited about that. We're want to just highlight today as well that at the end, toward the end of our behavioral health community of practice webinar, there will be a survey about future session topics. Part of the format for this community of practice will be that we want you to co-design with us what you think would be most helpful to learn about and to discuss together. So be thinking about that now and maybe jotting down some notes on a pad of paper as we go through, as you're thinking, what would be some things that you would like to learn about or some tools that you think would be helpful to you in your particular position. And so we'll come back to that, but just wanted to make sure to talk about that. We hope that today we're going to try and keep it always interactive and use a variety of learning experiences on our webinars. Today, we're going to do about 30 minutes of kind of a didactic presentation with panel or have a didactic presentation, the portion of it be about 30 minutes today and about 15 minutes of our panel. But please do use the chat feature, which is at the bottom of, should be at the bottom of your screen. There's a little function called chat. Click on that, and if you have any questions as we're going today, our lovely and talented Catherine Shaw will be asking those to the various speakers and panelists. All right, with that, we want to get started today introducing who is involved with the development of this community of practice. And I'm so delighted. That's one of the things I love about working at the University of Kentucky is that you get to work with really smart, talented, dedicated people in both inside the walls of UK as well as outside. And so part of the team that has been designing this community of practice has been our chair of psychiatry, Dr. Seth Himmelhoek, Dr. Lindsay Jasinski, who's the Chief Administrative Officer at Eastern State Hospital, our medical director at Eastern State Hospital, Chief Medical Officer at Eastern State Hospital, Dr. Andy Cooley. Also, Dr. Mark Woods, who's Chief Nursing Officer at Eastern State, has also been part of that, and that's from within UK Healthcare. So, and then one of our friends we work with here in the community as well, who's been part of helping to design and work on this program with us has been Julie Goski, who is Regional Director for CCBHC Health Initiatives at New Vista, which is our community mental health center here in the Bluegrass region. And of course, me, I'm going to be the facilitator for most of our calls and webinars. So super delighted to have this great group of experts involved with this group. In addition to the experts, we also have a big group of people who are working behind the scenes, staffing, who are also going to be part of helping to develop tools. As you all kind of give us stuff to work on, this group is going to be working on trying to pull together resources for you. So we have Mindy, Jenny, Lori, Kelly, Katie, Catherine, and Alicia. Thank you all for helping make today possible. They're really the folks behind the curtain who are making sure that each one of these webinars are really designed to deliver excellent content to you. So we're super grateful for their work. All right, now next we want to go to you and find out a little bit more about who is joining us for this first session of the Behavioral Health Community of Practice. Mindy is going to be launching a poll, or we're going to be through the magic of the Zoom features. You should see a little pop-up screen that says what role do you currently hold, and if you just want to chat or enter in, I've already seen results coming in. We'll give you a little bit of time to enter who you are today. All right. Okay, so Mindy, we have 20% of our participants are physicians or APPs. I'm surprised we don't have any nurses on today. That's really surprising. Practice manager or administrators, 21%, mental health professionals, 16%, and then other. So we'll come back to that 42% other later and see if we can do additional work to on that. So great. All right. So there's the poll for folks to see as well. Okay. So just again, kind of going back to our objectives for today, we are I'm not sure if those of you who are on our webinar today are familiar with the idea of a community of practice. It's really an opportunity to kind of bring together disparate groups to discuss a common issue or challenge, or set of issues or challenges, and then to share best practices for targeted solutions. So in this case, around behavioral health, we're really looking at ways that we can implement best practices, particularly screening and targeted assessments, disseminating evidence-based treatment guidelines and best practices again, also connecting folks to community resources for patient support, and then again, building relationships across the behavioral health continuum of care. So you may have heard of their communities of practice are often used at the federal level for various grant projects. Maybe you've been on one of those. Some of you might be familiar with Project ECHO, which is another model that is often used. So that's just a rose by any other name would smell as sweet. We're going to turn it now to, well, just want to also say too that optimizing patient care and really extending our existing resources is really the overall objective for our community of practice. We know that everybody is stretched so thin, and so developing those resource networks and relationships and really connecting each other to best practices. All of us are a lot smarter together than we are individually. So that's really the idea behind our community of practice today. Okay, enough for me. I'm going to switch over and hand it over to the people who are the real experts. Today, we're going to have some of our team talk about and give background on the current crisis here in Kentucky. Dr. Cooley?
All right, thank you, Trudy. On this slide, what it essentially states is we're all in the same canoe and it doesn't leak on one side. So about 20% of individuals in Kentucky report some sort of problems with their mental health. And the bad part, as you go down the slide in green, Only about a half of those individuals will seek help. And then in orange, what we're seeing is a trend across the country as well. There's a paucity, there's a big deficit as far as providers, and our psychiatric providers are aging out. Nothing particularly great news about that slide, but those are the facts.
Yeah, and so, if we take a look at our adolescents, we know that nationally, we can get a snapshot of mental health, basically, if we take a look at our emergency departments. And what we know from the previous year is that we saw a 31% increase from our adolescents in ED visits related to mental health, and saw a 24% increase in the ED visits. So we know that they are accessing care, adolescents are accessing care at a higher rate. Recently, high school students reporting signs of depression and hopelessness, that grew by 40%. And we also know, when you couple that with knowing that more than 500,000 of our Kentucky kids in high school have been diagnosed with a mental health disorder. So we know that it's very prevalent. And so the case for a mental health pandemic is more apparent when we take a look at suicide. We know that it is the second leading cause of death for ages 10 to 34 in Kentucky. And that, to me, if we just pause for a moment and listen to that, that it's the second leading cause of death for that age group. It's profound. And that's increased every year for at least the last 5. And so we also know that nearly 1 in 10 high schoolers attempted suicide in the year previous to the most recent, based on the most recent national survey. And so we're not talking about had suicidal thoughts. We're saying attempted to commit suicide in 1 in 10 last year. And so we know that housing displacement and emotional trauma from tornadoes in Western Kentucky or the recent floods of Eastern Kentucky are certainly worsening the mental health of our children in the Commonwealth. And while the mental health toll of the COVID pandemic has been widely covered, the statistic at the bottom right-hand corner, to me, is very profound. The part that's not covered most often is that over 200,000 plus children have lost a parent or a caregiver. And so, consistent with Dr. Cooley, things are grim for looking grim for our adolescents and children as well.
Right. On this slide, normally in Kentucky, the bluer you are, the better things are, but not the case in this slide. If you look at the transition of color here from light blue to dark blue, what you see clearly is Kentucky is in the darkest part. So what that tells us is we are experiencing high rates of depression, second highest rate for adults. And then about 1 out of every 4 people report that in the last 5 years, from 2015 to 2020, they just don't feel well. They feel worse, which is, this slide taken in tandem with our previous slide means that we need to do something a little bit different.
Yeah, thank you, Mark and Andy, for giving that overview of really the kind of state of behavioral health, both nationwide and here in Kentucky. And, it's really sobering. And that's why we felt so strongly when we've been meeting as a team, and certainly are dealing with our own challenges related to capacity for all of the patients with behavioral health needs. But we really felt like it was important for us to be, really bring the conversation out even bigger. And we certainly want to use and leverage the expertise of our own experts, as well as, our community mental health centers and others who are involved in filling the behavioral health gaps. But we also know that, in most communities, primary care physicians are really going to be the frontline providers giving care. And oftentimes, especially recently, it has seemed like primary care practices have felt overwhelmed with the number of patients and the complexity, sometimes the complexity or just the number of patients that they're dealing with. So really to provide better support for those primary care practices and teams, and then also to create a venue for continued conversation and problem solving together. So that's really what we're about today. Again, today is just the beginning of a conversation. We want to hear from you what you think are the biggest needs in your community and for your practice. So we'll have time to get your input later on that. I want to turn back to Mark Woods and Andy Cooley and really ask, you all are staying patients, are engaged in this work here at UK Healthcare. And if we could go to the next slide, I want to just get your perspective on what you're seeing in terms of the increased need for mental health services. How has that become apparent in your work?
Yeah, I can, I know Dr. Cooley will likely echo my sentiments, but the need is great. So we're seeing record volumes of presentations to our state hospital that we run. And in addition to that, we are seeing unprecedented presentations of adolescents and children in our EDs, so much so that we often have just as many behavioral health children, patients that come in with behavioral health needs outside of our inpatient adolescent unit, just as many as we have inside of our behavioral health inpatient unit.
Yeah. I agree with everything Mark said. I would just add just a couple of things. And I conceptualize mental health services as an ecosystem. You cannot touch one part without affecting the other part. And we see that as far as the basic connectivity between inpatient and outpatient services, as well as services used or needed to prevent some things such as hospitalization. So there's increased demand for the services that exist, but more importantly, there's a demand for services that don't exist.
Yeah, really good point. Really good point. Appreciate that very much. And I know one of the things that we've discussed as a team working on the behavioral health community of practice has been, is there the opportunity to go further upstream and to deploy some community resources that can then help prevent further downstream crisis. And so today I want to pivot and begin talking about some of the ways that we can begin doing that as well. And some of the tools and training that will be offered through the community of practice. We're pleased to have with us today Catherine Jury, who is Senior Extension Specialist for Family Health with our College of Agriculture, Food and Environment. Pleased to have her with us. And Catherine's going to talk about one tool, mental health first aid, that's widely used both within our UK healthcare settings, as well as in our campus settings to try and help improve and increase community resources in the same way that we do first aid training for a physical condition. We also want to be able to do that for mental health as well. So that's what Catherine's going to talk about today. Catherine, so excited to have you with us. You're up on deck.
Awesome. I'm so pleased to be with you all today. So we are going to talk briefly about what mental health first aid is and the value that it can provide to individuals in a wide variety of settings. We have multiple trainers within the Cooperative Extension Program, and we train individuals around the Commonwealth in a wide variety of professional settings, community settings, and definitely within the realm of healthcare. So we wanted to give you an opportunity to kind of see what it is, knowing that you will have the opportunity to either attend the training yourself or send individuals from your practice later on in the year. So next slide, please. I will not beat a dead horse, so to speak, particularly not in Kentucky, right? The state of mental health is not good in Kentucky and has continued to decline over time. There is just such a great need, and the need for understanding the way that people can experience mental health challenges outside of getting to a healthcare provider. There's just a great need in the community for individuals to recognize that this is a problem and be a first responder, so to speak, in that area. So next slide. We've talked already a little bit also about the disconnect that thankfully over the past decade, that the stigma related to mental health needs has finally started to decrease. That a vast majority of American adults would agree that it's not, there's no reason to feel shame for having a mental health disorder. Yet we know that many individuals with diagnosable disorders don't seek professional treatment or other forms of intervention to help them feel better. And so there's still a huge need in helping recognize when a person is suffering and how we can help. Next slide. So what mental health first aid does is it gives individuals without necessarily any type of professional background in mental health the ability to recognize and respond to a person who may be experiencing a mental health challenge. And what we know is that individuals, humans, we are really influenced by other people's opinions. And so having an outside person, someone who's not our own inner voice, saying, I recognize a change in you and I'm concerned. And many people want to help. We want to be good friends, good neighbors. We want to help individuals within our practices. That's why many individuals go into the medical and healthcare fields, is to be helpers. And so we know that many people want to help direct individuals to the best kind of care. They just may not have the right tools to be able to do that. So that is where mental health first aid comes into play. Next slide. So what mental health first aid, what that program offers is helping individuals be that first line of response to a person who may be developing a mental health or a substance use challenge with the goal of intervening in that person's experience until appropriate treatment and support can be received. So this training is specifically for individuals who do not have professional level education in mental health care. Next slide. Specifically, what participants learn are risk factors and warning signs of some major mental health and substance use challenges, what that could look like just in day-to-day interactions with individuals. So relevant information, not necessarily clinical information, but relevant presenting signs of what a person who's experiencing, for example, depression, anxiety, trauma response, psychosis, or a substance use challenge. And then it teaches a 5-step action plan of what to do, what to say, how to be useful to a person that you may recognize as experiencing a challenge. And all of this information is evidence-based, research-based, and the program itself has a very high level of fidelity. So this program, it was developed over 20 years ago and is in the United States, provided by the National Council for Mental Wellbeing. And so there's continued research and evidence to support the use of this program and its efficacy in doing what it claims to be able to do. All right, next slide. So I mentioned that 5-step action plan. Mental health first aid teaches individuals to be able to assess a person's risk of immediate crisis. So suicide or imminent harm. It teaches individuals how to listen non-judgmentally to a person who may be experiencing a challenge or a crisis, to give reassurance and information. So we teach participants what to say to a person that is helpful, honest, and may actually drive a person to seek the kind of care that they need. The program encourages appropriate professional help and intervention, as well as appropriate self-help and other support strategies. So recognizing that every community is different. The resources available in every community are different. And while we know that many communities continue to lack the appropriate amount of mental health care providers and facilities, we do know that resources are available and that for every person who utilizes a mental health resource, there are at least 2 more individuals who could benefit from that same resource. So encouraging people to utilize what's available to them, to know what those things are and how to access them meaningfully. All right, next slide, please. Where mental health first aid can help. So you can see a continuum there and the orange line that goes all the way across from well to recovery. A primary goal of mental health first aid is to prevent future mental health crises by helping to identify individuals' needs earlier and empowering individuals to be better advocates of mental health care and treatment. So the resources available in mental health first aid really cover the full continuum, whether you interact with individuals who may be mentally well, maybe experiencing some type of challenge, maybe in a crisis situation, or maybe in recovery. Next slide. Over 2.5 million people have taken mental health first aid courses in the United States over the past almost 20 years. So this is a program that's gotten a lot of really positive traction. You can see on your screen, both Lady Gaga and Michelle Obama have been spokespeople for the program over time. So you may have seen or heard about the program before, particularly through the pandemic, because this is a program that does address a lot of really pertinent needs and has virtual options that the need has really been more visible over the past few years. And so more and more trainings have occurred, and that's really good. Next slide. And so here's just some more places that you may have over time seen mental health first aid be discussed, which is, again, just really great that we're finally seeing more attention brought to the need for this kind of programming. Last slide, please. And so we know that people want to help. That's something that we hear over and over, that people want to be as useful as they can be in helping individuals who are suffering. And so mental health first aid is a great resource for individuals, again, that do not have professional level education or training in the field of mental health. All righty.
Thank you so much, Catherine, for that overview. And I should have said before I introduced you as well that one of the things that we're offering free to participants in this community of practice will be access to mental health first aid training that Catherine and some other folks who are part of our cooperative extension service are offer throughout the community. So there'll be opportunities to sign up later for that training for you and for a number of individuals on your team if you are interested. And again, that's offered as part of kind of like a benefit for being part of this community of practice. All right, well, let's kind of pivot a little bit and go to our panel. Catherine's going to be on our panel, but we're also going to have Lindsay Jasinski, our Chief Administrative Officer of Eastern State Hospital, and also here on the faculty with UK Healthcare and the College of Medicine, as well as Kristen Trudy, who is a prevention specialist in Uvista. And these are all individuals who in their organizations use mental health first aid as a tool for their teams. And so we want to turn to them. I'm going to pause for just a second also and say, Catherine, we'll come to the questions. We've gotten several questions in the chat. And so we'll kind of kick off our panel. And then I want to make sure that we pivot back to the questions and comments that folks have said. And we want to make sure to come back to those in just a minute. Okay, well, let's we can turn now to our panel. We want to start with our first question to Lindsay, and of course others, Kristen and Catherine, you feel free to join in too. Can you explain how mental health first aid helps or benefits a healthcare team? Like specifically, how does the UK Healthcare team and Eastern State teams use mental health first aid?
Yeah, absolutely. Thanks, Trudy. So mental health first aid is just an excellent tool for training everyone in how to respond to situations where many times our staff will say, I don't know what to say. This person has sort of walked into the room and they have so much going on. I'm noticing the questions in the chat, all the psychosocial things that are going on. Many times they come into a healthcare setting in primary care, in behavioral health, and any type of setting. It might be a pediatrician's office. And folks come in and they have all of these things and they kind of put all of those out in the room, and the staff say, I don't know what to do. Like, I really want to help. I just don't know what to do or how to unpack all of that or where to go and how to instill hope. And so from my perspective, mental health first aid really allows the person to sit and listen non-judgmentally. And that's a key component of this. The challenge when we're sitting there thinking, oh my gosh, what am I going to do, is we're not listening with intent. We're not listening to hear what's going on. And so the better trained folks are, the more confident they are to listen, to hear, and to be able to respond and provide support, and then help link that person with whatever services. It might be food and housing services, it might be mental health services, it might be any of those things that are needed, but really gives that healthcare professional the core confidence that they need to be able to respond. I think the other piece of this that we've seen, we train our staff at Eastern State in these topics with mental health first aid, and a secondary benefit is that healthcare is stressed right now. We all have more things on our plates than we've ever had. We have challenges that we're trying to face, and it really helps us to be able to support each other as teammates, to say, hey, you seem like you're having a tough day. Help me understand what's going on. How can I help support you? And to be able to open those conversations, reducing stigma, being able to support each other as healthcare professionals throughout this as well. We know that the mental health impact on healthcare professionals is magnified as well. And so I think there are dual benefits to the healthcare team, to having folks on every team who are trained in mental health first aid.
That's great. That's great, Lindsay. Thanks so much. I want to go to the next question for both Lindsay and Kristen, since you all deal with this. So as you look at your, you all are behavioral health providers and you use mental health first aid. But what about folks who are primary care providers, pediatricians, and other types of practices? What's the role for primary care providers in mental health first aid?
Yeah, so when an individual approaches you, they may feel very distraught, but you really have the opportunity to help them get the mental health care that they need. So your role as a primary care provider is to really identify that mental challenge by knowing the signs and symptoms that a patient may be. Again, listening non-judgmentally is so important. You have the opportunity to give reassurance and refer them to get the help that they need. And this is something that the mental health first training is going to aid you in that process. So an important role that primary care providers have is self-care. So I believe that self-care is so important because we all know that it can be so difficult to serve others when we are overwhelmed ourselves. So self-care is different for everyone. So if you've not done so already, I encourage you to create your own self-care plan whenever you feel overwhelmed or stressed at the work that you're doing.
Great, thanks, Tristan. Lindsay or Catherine, anything that you all want to add to that? Any thoughts?
Yeah, I totally agree with what Kristen has said. I would add that I think at this point, given the magnitude of mental health needs that exist in Kentucky, that primary care providers are really critical in being able to provide early identification and have these conversations and say, hey, it seems like there's more going on. Those are difficult conversations sometimes, especially when you're backed up with patients. There's lots of things going on, but taking that pause and being able to really assess holistically the person's health is critical. And I think primary care is going to continue to see increased demand here, and having folks who are trained is going to be really helpful in navigating some of those conversations and getting people into services where they're needed.
Great. Well, let's talk, shift over, Kristen, and I'm going to say also, Lindsay, you could answer this one as well, is how do you integrate mental health first aid into patient care? So how does New Vista as a community mental health center use this for their team?
Yeah, so we instruct individuals that, mental health first aid and patient care is so important because you really are that first line of defense for an adult or child in need. So mental health first aid can be used in time. It's very beneficial
Kristen,
to use mental health first aid and
I was gonna
patient care.
Pause for just a second because you were breaking up just a little bit there.
Yeah.
I want to make sure folks can hear you. It's back again.
Sorry. Okay, so we're good now. Everybody
Yeah.
can hear me. Okay, I am so sorry. So as I was saying, it's very beneficial to use mental health first aid in because some individuals feel very comfortable in confiding in their primary care providers. So individuals reach out to those trusted adults, and we can really help to connect those dots and assist them in finding resources. So once individuals have completed the training, you're going to have those skills that you need in order to assist in non-crisis and crisis situations by using that mental health action plan that was discussed earlier. So this training covers how to assess that situation in order to determine if it's a crisis or not, and what steps that you may take in each situation. So you have the opportunity to offer hope by providing reassurance, information, as well as advice. And that's something that New Vista it feels very strongly on, is that, we want to offer hope in any way that we can. So you also have the opportunity to create a list of professionals who can help. And this could be psychologists, counselors, substance use professionals, or even certified peer specialists in your community. So many of you already have this, but it truly prepares you and helps you feel more comfortable during this process, because we all know that preparation is key. So this training also covers what to do when an individual doesn't want help which can be pretty common among those who have never addressed their mental health needs. So I believe that practitioners truly have the power to spark the conversation about mental health. So this can be as simple as saying, we talk a lot about your physical health. How are you feeling about your mental health? So some individuals may not expect this question, but it really gives them the opportunity to share those details with you, and it really promotes holistic health. So it's important to note that individuals may not open up about their mental health at first, but they're going to remember that you asked, and it's going to be in the back of their brains. So they may schedule another appointment with you to discuss their mental health needs. And this is where you really have the opportunity to implement that first aid action plan. Again, it is so common to feel exhausted, maybe even emotional or scared after assessing a crisis or a non-crisis situation. So as I mentioned previously, it's so important to develop your own self-care plan to care for your own physical and mental health. And this is something that you'll have the opportunity to do throughout the mental health first aid training.
Great, thanks, Kristen. So one of the questions that we get to is mental health first aid training, and we'll direct this to Catherine, is it just for behavioral health providers, or who are really the best people to take it?
Anyone that has interactions with other humans.
That's a pretty broad group of people, Catherine.
It is, and particularly in healthcare settings, when you encounter individuals, they're likely already stressed. No one generally takes, vacation days and, just are overjoyed with the need to, encounter the healthcare system. And so anyone in the healthcare field that works with people can benefit from mental health first aid. And what we found through providing these trainings over time, particularly in healthcare settings, is that receptionists, individuals who work with patients that they may see in high stress environments, insurance clerks talk a lot about not knowing how to interact appropriately, or what to say when people maybe have big concerns that they bring up. So not just providers, but anyone, technicians, anyone in the healthcare setting, like I said, that hasn't had professional mental health training can really benefit from this program. It is 7.5 hours long. So it's a good overview, but it's not a college course. So this is a lay training. This is not clinical training by any means, but really anyone within a practice can benefit personally and professionally from mental health first aid training.
Great, thanks, Catherine. Let's turn over to our questions and comments that we've received through the chat, because I think these are really kind of bringing up some issues that we're going to want to tackle, both not only today, but going forward with community of practice. Catherine, Shaw, do you want to read us off some of those?
Yes, I'll be happy to. So the first one is, so many of my patients need therapy, and I have a therapist co-located in my office, and yet they fight it strongly. Everyone just wants a pill.
Yeah, so Lindsay, and maybe I can even open this up to Dr. Cooley and Dr. Woods as well. Any thoughts on that one for Dr. Stevens?
Yeah, I'm happy to address that. So I'm a psychologist by training. That's been my career, my background working as a therapist for many years. And this is accurate. And that is, it's in part due to some of the cultural perceptions. I think, there's lots of different ways to address that. I think using evidence-based practice as a therapist and saying, we're going to do this for 3 sessions, and here's what I expect to see at the end of those 3. Let's try this first. Is something I've seen be really effective. I do think that everyone wants sort of a quick fix and they want to get rid of any negative emotions. That's sort of the culture that we live in. And to the extent that I can, I encourage people to embrace those negative emotions and understand them, because emotions serve a function and they're there for an important reason. And to the extent that we just get rid of them, we don't really solve the problem in the long run. That is a major challenge, and it's a challenge for multiple reasons, part of which is getting people to services. I think this is addressed later too, which is, people, going to therapy for multiple sessions, getting a ride, having the resources to pay for those things can be a challenge as well. So I think a lot of this is an individualized conversation. But as a psychologist, I lean toward, having the conversation of let's try this and see, or let's try this and this to move forward.
Excellent. Catherine, you want to go to the next question?
All right. The next one is the impact of social determinants of health, including insurance coverage, travel limitations, education level, and more, and how they are contributing to the increased percentage of mental health issues.
Yeah, and let me say thank you both to Dr. Stevens and to our friend Becky Blevins from McDowell for that comment about social determinants of health. Lindsay and Kristen, do you all see that in your practice as well? I'm sure you do. I'm asking an obvious question here. Yeah.
Yeah, it's a significant challenge. We have a lot of barriers in Kentucky to getting access to mental health services, and that makes all of this more important, right? So anytime that someone has entered the healthcare system, we need to be able to talk with them and gather more information and help them understand we can support them in different ways with their mental health, because they may not have the ability to continue coming back, or they may not have the resources to do that. And all of those stressors that people are experiencing are contributing to what we're seeing. I wish I had a solution. I don't have an immediate one. This is a system level issue, but I think this group as a whole can come together and potentially make some recommendations on what the needs are that could be addressed that would help people get access to services more readily.
Yeah, and that is something that we at UK are looking at, implementing some screening, social determinants of health screening and connection to resources, and deliberating that. So if that's something that's of interest to you all, or having a larger conversation just with the subset around behavioral health services, then we're happy to do that as well. So definitely put that in the survey at the end of the time if you think that would be something that would be helpful or of interest to you. Catherine,
New Vista
next
is
comment?
also
Oh, go ahead,
implementing.
Julie.
I was going to say New Vista is also in the process of implementing kind of some assessment of social determinants of health when our clients start services, because much like Lindsay just said, yes, they play a huge role and they impact whether or not people come back. So we too recognize the importance of addressing those.
Great, thanks, Julie. Okay, next comment, Catherine.
All right, we have some concerns regarding young people and children. First, I'm breaking this one into two different pieces, having to do with the children being isolated and out of school during the shutdown period of COVID, and how they are struggling as they come back to school and how to deal with that.
And the comment too about the bullying being off the charts. Yeah, it's like,
right.
Yep. Yeah. Dr. Jasinski or Lindsay or Mark, do you all want to talk about a little bit about kind of the situation we have here, with our kids at UK, kind of how we're addressing these kind of needs?
Well, what we are trying to do is work with our state partners to, solve some of these. These are not short-term answers. These are not easy to come, to bring to fruition. And some of these take a long time. But yeah, no, we're seeing a lot of the same things that you've described, that was described in that in the comment. It's reintegration of the kids back into school. You know, they've gone quite some time residing outside of school, and then you've got some of that re-socialization for them. And then, you know, being the spouse of a teacher, it's also how do the teachers, how do they welcome the children back? And so there's lots of stressors. And I think I mentioned it earlier as well, you know, there's a tremendous amount of natural disasters that have happened within the state that is compounding some of this stress on our children. I mean, certainly our adults, but the part that we don't often talk about is the children. Is, you know, whether it's the floods of Eastern Kentucky or the tornadoes from, you know, Western Kentucky that were, you know, that was before that. Those are very stressful. And then when you compound it with so many of these children coming off, you know, as we begin to come out of this COVID pandemic, you know, we're left with some of the aftermath of a lot of these children have suffered unspeakable stress, right? Of having caregivers pass away or not being around. And so, yeah, it's very real. And I think, you know, we'll talk about some of the things as we move forward with these series, things that might be helpful for people to hear and to learn about new programs and new systems of care. But it's going to be a long journey back.
And Becky Blevins also commented that while students are back, many of the roles at schools are not filled. So that workforce shortages of counselors, nurses, athletic trainers, et cetera, who were there in the past to help students adjust and kind of deal with what they were doing. You know, that workforce shortage has, you know, makes it also just where you have some gaps in our normal structure to care for kids. So it's such a big, you know, a big challenge, both the, you know, the fallout in terms of behavioral health from the pandemic, as well as the workforce shortage. I will say one thing I wanted to point out, and that we will provide to participants after the call, is this team did really some great work to try and bring together a number of mental health resources. She's not on the call on our webinar today, but Alyssa Briggs and some of our pediatric mental health experts have really done some amazing work to try and provide some resources to parents and to other professionals, school professionals. And so those resources are available through our mental health site, and we'll provide the link to folks to be able to get to those. There's a number of videos that are just very, very good that are resources to you all to use. So we'll get that out to everyone after today's webinar. All right. Excellent. Okay, so now remember how I mentioned that we were going to have a poll. We're at that time. We want to hear from you. So we have some content scheduled out through May, or some ideas of what we'd like to do through May. But we also felt like we wanted you to be the co-designers with us of how we tackle this particularly challenging situation in Kentucky. And so Mindy's going to launch a poll that will allow you. We've kind of pre-populated it with some topics, but certainly if you have other thoughts on some things that you think we ought to cover, we're going to give you a little bit of time to just chime in about things that you think are important, whether it's leveraging technology, using non-pharmacological interventions, linkages to de-escalation, linkages to care, depression, chronic disease management. So folks are entering in their responses, and don't forget to scroll down, because if your window is kind of small, there's a number of potential responses. So we'll just kind of allow folks time to go ahead and enter their responses into the poll. Excellent. Looks like we have about 40% of folks have answered so far. That's great participation. Thank you so much. Really helps us to design and prioritize how the type of information that we're going to offer in future webinars as well. Also too, Mindy in the chat put that if you have additional ideas, like let's say there's a topic that's not on here today, kyrec@uky.edu is and that's in the chat. Just go ahead and email those to our team, and we will also add those and consider adding some content or some tools related to the topics that you want to see. Excellent. Thank you so much. This is really helpful. It looks like some of the really big topics today, certainly de-escalation and linkage to care, mobile crisis response, health equity were some of our top ones that folks gave feedback about. Thank you so much. This is very helpful. Okay, can folks see the results, or do I have to share them? I'm asking out into the ether from our team.
We weren't going to share them, but I can if you would like me to.
Okay, go ahead, Mindy. That way people can see kind of what came out from the response. There we go. And we'll make sure to use these again for future topics. Okay, we're at 12:56. So we are very anxious to make sure that we are using your time well. And so today I want to thank all of our panelists. Thank you so much for providing the gift of your time today and your expertise to the team. We're very excited to have them on future, involved in future sessions as well. We want to give you a reminder that our next Community of Practice meeting will be on November 3rd, 2022. We also want to make sure that you know that you can scan that QR code that's on your screen right now, and you can sign up for mental health first aid training. We talked about it today, and it's already live out there. Sessions that will be available later on in the year. I think the first one starts in January. Am I right about that, Catherine? Okay, I wanted to make sure I said the right date. So you can, and it'll also be available on our website after the webinar. And you'll be getting an email with some resources that'll also be available through there. So also that kyrec@edu, any comments or questions, thoughts, ideas, again, this is intended to be a conversation led by you as well. I would love to hear from you. And you can also feel free to kind of add additional things into the chat. And one thing I want to make sure is to remind you is that we are asking folks to register for each session, just because we don't want to put like a bunch of every single webinar on your calendar. We wanted to make sure, so do make sure to sign up for each one of those sessions, and then we will again be providing you with additional resources. If there are things that you feel like you need, let us know as well. And thank you, Mindy, for putting the Eventbrite registration link right in the chat. That's very, very helpful. All right. So I think that covers most of the logistics. Mindy, did I forget anything today?
No, you were perfect.
Okay, that's very rare for me. They script me and tell me what I'm going to say, but sometimes I forget to say something important. So gotta have a team. We get by with a little help from our friends, right? Well, thank you so much, everyone, for being on the call today. You've been very lovely. Appreciate the opportunity to share. Thank you again to all of our panelists for sharing your expertise, and we look forward to getting to see you back again November 3rd. Thank you all. Take care.
Thanks, Trudy.